The chair lays out on a statement.
Thank you, Mr. President. Members, I would like to rise and join with all of you here today to thank Senator Williams and the committee for their hard work on this budget, on this Senate Bill 1. He's been a fair, inclusive, and very efficient chairman, in my point of view. And I feel honored to have had the chance to serve as a member of the Finance Committee. Moreover, I'm happy to have served on the Public Education Work Group. Kudos to Chairman Patrick and to our committee members. We've made some great progress, and we're able to add almost $1.4 billion to the Foundation School Program. About 40% of Texas's schools districts will be better off than before the cuts that happened during the last budget cycle, and that is pretty awesome. A giant step, if I may say, in the right direction. Now, I voted for the committee substitute for Senate Bill 1 because I believe this bill is moving truly in the right direction. However, members, this budget is just that. It's the first step. We need to continue working toward restoring last session's cuts and eventually making our way toward a better budget. We need a truly pro-lifetime budget, a budget that affirms our state's commitment to safeguarding its most vulnerable citizens, starting with all of our children and focusing in on the elderly of our state. My constituents really felt the effects of last session's cuts to public education. When a school district is a community's principal employer, losing hundreds of school district jobs really makes a negative impact. In Hidalgo County, it was estimated that the 2011 budget defunded nearly 1,000 school district jobs, and nearly 500 school district jobs were cut in Cameron County. That's why, members, I didn't support the budget last session. It simply hurt too many people I represent. Unfortunately, members, under the current political climate, it is regrettable that Medicaid expansion cannot be appropriately addressed. So what's the alternative? More people without insurance showing up at the front steps of our emergency rooms, and the rest of us who are insured continue to pick up the check for that incredibly expensive emergency room visits. Well, I'm not complaining, but many are. Unfortunately, many working low-income Texans aren't offered health care coverage through their jobs, and regrettably, many more simply don't get paid enough to purchase it. This doesn't include the individuals who are unemployed, underemployed, and self-employed. These are crisis situations. People put off doctor visits because they cannot afford them. They're taken to the hospital's emergency rooms when their health takes a turn for the worse. People have actually died because they can't afford to live. This issue is vitally important in my Senate district. The Valley population is growing, yet the region has substantially higher property rate than Texas or the United States as a whole. If Texas opts out of the Medicaid expansion, these uninsured adults will have no medical assistance available in 2014. Choosing not expanding Medicaid is essentially choosing not to provide any safety net for our neediest Texans, even though the obligation is with the federal government, even though this is an opportunity for Texas to recover our money from the United States. Ultimately, people will be falling through the cracks. So what alternatives would succeed in fixing Medicaid while also helping more individuals get insured? Chairman Williams, I've seen your comments regarding co-pays. Senator Dewell, you have a proposal to use block grants. Those are great starting points. They really are. Let's have a meaningful conversation about those options and others. Let's put our constituents first by expanding Medicaid and reducing the number of unhealthy Texans. Whether we do it like Florida, New Jersey, Arkansas, or whatever, we need to do it, or at least have a valid conversation about doing it. I think we owe it to our constituents to do our job, debate the issue, and come together for the greater good. But I must stress, millions of Texans can't afford for this issue to be kicked down the road. Right now, millions of Texans desperately need access to care. In closing, I want to say that I'm hopeful. I'm hopeful that this session's budget will have laid the foundation for a better Texas, provided we don't lose sight of what we believe in, helping the citizens who elected us to represent them here today. Thank you once again, Chairman Williams, for your leadership on this year's state budget. Thank you, Mr. President. Thank you, members.